Pharmacy exam MCQs. First question. Which of the following asthma therapies is effective by decreasing the amounts of released leukotrienes? Options are saferlucast, Silutan, montelukast, alprostadil, bimatoprost. Answer is option B, that is Silutan. Saferlucast and montelukast exert their effect by blocking leukotrienes at their receptor. Silutan, which acts by inhibiting lipooxygenase, will decrease the synthesis of these inflammatory mediators. Therefore, it is the only drug listed that will decrease the synthesis and consequently the release of leukotrienes. Alprostadil and bimatoprost are both prostaglandin analogs. Aspirin exerts its antiplatelet effect by inhibiting. Options are cyclooxygenase 1, that is COX-1, COX-2, COX-3, prostaglandin synthesis, leukotriene synthesis. Here the answer is option A, that is COX-1. Recall that in prostaglandin and thromboxane synthesis, COX-1 is responsible for much of the daily production of maintenance eicosanoids. COX-2, while also contributing to daily production of prostaglandins and thromboxanes, is more important in inflammation. COX-3 is the debated splice variant that may be the central source of prostaglandins that contributes to CNS function of eicosanoids. Also recall that it is thromboxane that specifically has platelet aggregating ability. Therefore, it is through inhibition of COX-1 and the subsequent decrease in thromboxane, not prostaglandin or leukotriene synthesis, that the antiplatelet effect of aspirin is affected. So, aspirin exerts its antiplatelet effect by inhibiting cyclooxygenase 1 enzyme. Acetaminophen toxicity is characterized by options are profound vasoconstriction and pain, severe abdominal cramping and diarrhea, central nervous system stimulation and seizures, profound liver damage and failure, tinnitus. Answer is option D, that is profound liver damage and failure. Acetaminophen toxicity is characterized by a profound hepatotoxicity, which is mediated by a reactive intermediary formed on saturation and depletion of the normal metabolic pathways. This does not affect the vasculature as with the ergot derivatives, thus no vasoconstriction is observed. Neither is severe GI upset evident, although mild GI upset may occur early in paracetamol or acetaminophen toxicity, nor does profound CNS stimulation occur as it does with aspirin toxicity. Tinnitus is a sign of salicylate overdose. Therefore, answer D is correct. Which of the following anti-gout medications are specifically used in acute attacks? Options are colchicine, allopurinol, probenecid, pegloticase, febuxostat. Correct answer is option A, that is colchicine. Allopurinol, probenecid, pegloticase and febuxostat, although effective in preventing attacks of gouty arthritis by lowering circulating levels of uric acid, they are not effective in treating the acute inflammatory situation that characterizes an acute attack. Colchicine, by inhibiting the migration of pro-inflammatory cells into the affected joint, will reduce the inflammatory process, thus elevating the pain and edema associated with acute attacks of gouty arthritis. The selective cyclooxygenase 2 inhibitors, that is COX-2 inhibitors, have been associated with which of the following adverse drug reactions? Options are severe ischemic colitis, torsade de pointes, cardiovascular thrombotic events, acute liver failure, Churg-Strauss syndrome. Correct answer is option C, that is cardiovascular thrombotic events. The primary side effects that have been associated with the COX-2 specific inhibitors are gastrointestinal bleeding and more recently potentially fatal thrombotic events. The latter is thought to reflect a toxicodynamic effect that results from inhibition of vascular COX-2, which contributes to the daily control of platelet and or vascular function. Severe ischemic colitis has been reported with allocetrone, torsade pointers with older second generation antihistaminics and cisapride, which is no longer available for use, acute liver failure with acetaminophen overdose, and Churg-Strauss syndrome with saferlucast and corticosteroid withdrawal. None of these adverse reactions has been associated with the COX-2 specific inhibitors. So hence here the correct answer is option C, that is cardiovascular thrombotic events.